I'd like to let the body know that the Auditor General today released the results of an audit that he was directed to do by the Legislative Audit Commission last year related to the estimates and costs of the HBIA and HBIS programs for 2021 to 2023. As the House Republicans predicted, the audit found alarming and astounding differences in the estimates of the program versus the actual enrollment and expenses. The governor's own budget for fiscal year 26 acknowledges that we cannot afford the programs and that we have far outspent any estimates, which is an affront to the hardworking taxpayers of Illinois. In addition, the program was found to have eligibility errors, which added to the costs, and the program also had poor internal controls in many ways. It is not enough for us to say, "I told you so." We must do better. Now is the time, and this is our opportunity to work for taxpayers, not promote fraud and overspending. I hope that's something that all lawmakers can get behind. Thank you.
So I think the thing that is missing from the reporting, and what I would point out to you, is that, number one, people's immigration status changes. During the course of a year, you've got people who weren't who were eligible for the program, who became ineligible for the program. And so you're continuing to, even though you expect that people will move on because, well, it may be their immigration status, it may be because they got a job that has health care coverage associated with it, but you expect them to move on, and maybe they didn't move on either because they didn't know they could, should, but that happens, I hate to tell you, on Medicaid as well. It's why we do every year redeterminations, and we did it with this program as well. One of the reasons that we even know about some of those people is because of the redeterminations. So people get removed from the program as a result of the redeterminations, but before they got redetermined to not be eligible, they were still on the program, and that cost taxpayers money. So that's a lot of, I think, what I would say about that. But the broader context is people need to get health care. I am in favor of universal health care. However that comes together, and we can talk about the myriad ways that we could do that. But people don't go get health care, get treated when they don't have a problem. And so it's some evidence anyway that there are an awful lot of people out there who need coverage, who aren't getting it, or who will do anything to get it. And I think that's a sad state of affairs in our society.
And as a son of an asylum seeker from Ethiopia, and somebody that's from a proud immigrant community born and raised in the city of Chicago, I'm looking forward to fighting with you. I'm looking forward to fighting with ICER. I'm looking forward to fighting with my colleagues that are standing right here behind me today to make sure that we fully fund the immigrant services line and get that increase that we want, to find that progressive revenue, and to fight for other awesome bills that my colleagues that are supporting, such as Safe School for All, and all of the wonderful platforms that we have in this group this morning. So thank you so much. Go get them.
This program started in December of 2020. They did not start seeking federal reimbursement for eligible services, like emergency services, till March of 2024. There you go. That is not properly running or administering or taking care of Illinois state taxpayer dollars. No other state in the nation has a program like this. We are the only state that puts this burden on Illinois on their own state taxpayers, taking this on. And to not run it properly and to have these large cost overruns, that's how you end up with a budget deficit. That's what's crowding out spending on education. That's what's crowding out spending on other components of the state budget.